Okay, hello everyone. So on today's agenda, we actually don't have much on it. We'll mostly be covering the progress on the deployment and basically maybe a recap from the meeting yesterday with the rest of the team that was able to attend. Maybe I will hand the floor over to you, Dr. Reginald, to give opening remarks.
So again, on behalf of Professor Francisca, Professor Miriam, please welcome to our weekly meeting. We have done a lot of work in the past few months. Last week, we started off by looking at the symposium at Leiden, Global Impact Health Symposium, which was very successful. I'm sure Bart has something to say on that. We have the deployment, but the key question that came from the Mekele team were very good for us to start looking at the next either MVP and how to deploy that. Then the agreements and where we are with the agreements. Then lastly was also the response coming from some facilities on the expectations. And I mentioned one from Kenya, Beacon of Hope, who think that we need to create an atmosphere of exchange programs across each other. And because we are building a very strong network of African researchers, scholars in the area of digital infrastructure, be very nice to get exchange programs. And this is also how we move to next level of donor support. So that's what I would say. So everybody welcome. Back to you, Mariam.
Thank you, Dr. Reginald. Maybe Bart has something to say as well for opening remarks.
Well, yes, I can say something because last week I was on the symposium, Life Science and Health, which was in Leiden, and several of you were on the call. I could see that, and I just want to highlight that it was a great success for VODAN. The VODAN project was elected as the most inspiring and the most innovative project of all the ones that were presented at that day, which was, I think, a fantastic achievement. And what you could also see was that a lot of people were interested in terms of how have you set it up, what are you doing, how is it possible that in such a short time we've been able to link up almost 90 different institutes using a very good concept. There was a lot of discussion about the fact that within VODAN, the data stays under the control of the data owner, and so there's a federated structure. And you could really feel that a lot of people said, "Hey, that's an excellent idea. We should think of that more often." And also there were some good comments in terms of the knowledge transfer that was done, let's say, from people in the States, people in Europe, people in Africa, and it was really working as a team. So all in all, a lot of applause and a lot of positive messages in that meeting. It was really great to actually be there, and as some of you may have seen also. So kudos to everybody who worked on this, because it was recognized as a fantastic project.
Oh, thank you, Bart. Okay, so maybe we'll now move to the agenda, and that's the deployment progress from the different country coordinators. We actually covered this yesterday, but we were missing a few other countries. I don't know if we have Nigeria on the call today. Maybe we could start with Nigeria. Oh, Abdullahi is on the call. Or Ibrahim.
Yeah, Dr. Ibrahim can go.
I think he dropped out. Okay. Kau.
Hello, can you hear me?
Yes, yes, we can hear you, Kawu.
Oh, okay. So in terms of deployment for Nigeria, I think we are able to deploy across all the facilities. The 4 facilities that are actually in the southern part of the country, they've just acknowledged receipt of their PCs and they are supported by the data steward to set them up. So I'm aware they have now received it. It's just the setup that is about to, get completed. So yeah, so basically, except for these 4, the other facilities have now properly set it up and then have tried to use it even in many cases. Yeah, is there any specific?
Sorry, I didn't hear that. Oh.
Yeah, I'm saying if there any specific information you would like to know.
Well, just any new updates from the last time is also with the agreements, the agreement signing and
Yeah, so the agreement signing, Dr. Ibrahim is here, so he could speak to that.
And I had a question. Hi, Kawu.
Yeah,
nice to hear and good to see everybody. I want to say that it was really, really exciting to have that award last week. Thanks to everybody. It was really, really great. And thanks for the deployment. And the question that I had was, what is the response of the data clerks? We have seen, of course, the videos, which was fantastic and amazing to see all of them in their different locations. And has the data production started? I was curious about those things.
Okay, so probably I'll start from the last question, whether data production have started. So in some facilities, yes, they did indicate that they are making some entries. And I think in the process, they are able to report the challenges in doing that. So for instance, General Hospital Mina, they did mention they have made some entries and then they reported that when the power goes off, which is normal here, the system goes off, and that's a problem because it will impact the operating system, even data stored and all. So we've come to realization that we needed at least a backup power to enable them to shut down safely those computers. And this applied to all the facilities. The second finding from deployment was the issue of the internet. So for most facilities, and we're actually trying to take proper inventory of 2 things. So energy and internet availability in those facilities. Even for energy, how many hours and what days, so that we know our expectations of when this data and the freshness of data, in this case, talking about the data quality. So we're trying to generate a questionnaire to document this. But from what we find from deployment, what is evident is there is virtually no facility-based internet service for most facilities. So what happens is they have their mobile data that they had to connect using a USB from their mobile phone to the computer system, which then enables them to enter records. So for any record, there must be internet connection to enter it. So that was the situation on the internet in relation to the deployment and subsequent use of the system.
So have you been in touch with the McKellar team, because they have been working without internet and I mean power, I don't know. Is it the
so
there are no batteries in the computer, so if the power goes off, that's
so
it.
the powers go, yeah, so and that's impacting even the hardware and all in the long run. So there should be there's usually this UPS system. I think under $100 we should have one for each system that will at least enable them to shut down, for about, it could take for about 5-10 minutes before the system shuts down. Yeah. So under $100, we could get that for each facility. $100 each, yeah.
So are you planning to deploy those?
I'm not sure if there's any budget on that. I'm just maybe Dr. Ibrahim will respond to this, but I'm just making my observation directly working with them, And then, so in response to whether we've worked with the McKellar team, I think what I know was with Umar, he had contact with Oluwale, and so the last version of the image was what we used for the deployment. Earlier on, we did report that both the data entry as well as the dashboard seemed to require internet, but it was improved upon to now that the dashboard works without internet, but for every data entry, which requires CEDA connection, there is that requirement to have some, internet to enter those records. So, and I think the explanation was we can't have localized CEDA because that could also, take more resources from the systems, and that's why it's been accessed remotely. I think that's the case.
So you have not, so you are dealing with the problems, but you have not discussed it with Samsung.
Well, I'm not sure if they are not aware, but Oluwale is definitely aware of those challenges.
But sorry, who is responsible for the deployment in the Nigeria team?
Omar.
And who is overseeing Umar?
So I directly oversee him. And that's the last communication I had on this.
Because there are different models. There is the model where you could depend on the service through a central computer, the model that Michele was going to use and Tigist was proposing in Addis. Or there is the possibility of including the CEDAR service systems in the facilities. So I would suggest that before we have too many problems, that should be tested. If that is a problem.
Yes, I think we can have this conversation with the technical team again, and then see what to go forward with.
Yeah. So there are at least these two options. I don't know, Samson is there. Samson, are you hearing the conversation?
Yeah, this is Gato.
Hi,
I'm
Gato.
just following. Hi, Prof. How are you?
Good, good.
Yeah, regarding the internet issue, I think the templates require to be connected to the bioportal, not the CEDAR system, but bioportal. The CEDAR system is already installed in the image. However, the templates need to retrieve the vocabularies from bioportal. The bioportal is not installed locally, so that's why it requires internet to retrieve it from the internet, the vocabularies. So there are two solutions that Samsung proposed last time. One is and the good one is installing bioportal locally, and so that the system can interact with the bioportal. That means onto portal locally, it interacts locally. However, the second is recreating the templates without the vocabularies, because the vocabularies, the templates, CEDAR templates produce unique addresses for the fields. So we can have templates without vocabularies for those facilities which has no internet connectivity. So we have two options. One is facilities with internet, which can easily retrieve the vocabularies from bioportals through internet. The other is facilities without internet. So we recreate the templates which doesn't need internet connectivity. So this was the proposal. I don't know how far we progressed. Maybe Mariam could help me here. But now in the Mekala team, we are trying to use that part, because we are using the client server architecture, and we are going to install the CEDAR system in the server in the hospital, which has no internet connectivity. So we will recreate the templates that do not need connectivity to the bioportal for now. When the internet comes back, we will deploy the templates that needs internet. So that's one thing. And the other about electricity. So I think the Nigerian team raised this issue last time, several times. So if the electricity had surges like electric surge, I think we need UPS to mitigate the problem, because if there is surge, the computer dashboard could burn and we could lose the computers. Therefore, beforehand, we need UPSs to protect those issues that could come up in any facilities that we have. That's it. I will come back to update you our progress later.
Thank you very much, Gato. So, Dr. Reginald and Mariam, I think that this requirement of having the UPS in connection to the unpredictability of electricity is something that the country coordinators should absolutely be clear about, because we could not lose such a capital in computers if we have not protected the computers and the data, first of all, through the UPS system. So can this be communicated, and also can the country coordinators agree on this point, Dr. Reginald?
Yeah, I think according to what Putu was trying to do per health facility, this is one of the key questions that came up, if we have any backup at each health facility so that we don't lose any data. So it's a key question that we need to explore. Thank you, Professor.
Dr. Ibrahim, Dr. Sakinat, can you also clarify that this position is going to be clear for the Nigeria situation?
Yes, Professor. Yes.
I think that it is not safe to have the clerks continue on the computers if there is not a UPS available. So we need to then progress in an orderly way. First UPS, then the use of those computers. Dr. Sakinat? Hello?
Yeah, Prof, I think I will just, we'll have that discussion at the Nigerian level.
Yeah, I think that Sakinat says a UPS will be needed. So please make sure, Kau, to provide those instructions to Umar and the installation team, eh? Please.
Sure, I'll do.
All right. And so, Kau, you are saying that option 2 with the adaptation of the templates to a non-onto portal dependent entry has your preference. So you will be exploring that.
Yeah, so that would mean recreating the templates like we have been used to, but this time it's local. So I'm just not sure, which is something maybe Gate will confirm whether it will populate at the dashboard, since the parameter, I don't know. Except if we're going to set the system up again.
Ezra was, yeah, Gatu.
I guess Ezra would answer it well, but in my thinking, there wouldn't be any problem because the variables are already defined in the dashboard in the Laravel programming. So be it onto portal dependent or not, the variables are already there. So it won't be, I think there won't be any problem to display it on the dashboard. But no. Ezra would be the right person to answer it.
Yeah, I mean, Mariam, yes.
Yeah, I could add to that. There actually won't be a single problem with connecting to the dashboard. Also, we could use the multiple choice option so that we're able to control the entry from the, let me say, the data clerks. Otherwise, we're going to have people responding female or F or different kinds of entries, which might distort the interoperability, bit. Yeah.
Yeah,
Sorry?
so what I was thinking is simply to duplicate the template and then fields where there are usually, I think there are about 4 of the fields that are affected that require internet. So those are the fields to change. I remember very vividly the field about country, the field around diagnosis, what other field? But anyway, so those, they are just few of those fields that need to be worked on. So it's not any big deal, but I'm just not sure whether that will propagate, the changes will propagate, since I don't know the underlying, you know. But I think we'll just try it and then get back.
Yeah, it does not affect the dashboard. I think that it will affect the dynamic queries. But since we are not testing those at this moment, I think that solution is perfectly fine for just now. And then meanwhile, we can work on the different strategies related to Onto Portal. So I think that makes sense.
Yeah.
Samson?
Yes, hello, Prof. Hi, everyone.
Hi.
I think Abdullahi is raising a good concern. What we will try to do is, because we are also working on an offline version, we will be testing it on our side and we'll report back next week. But like Gato said, ideally, it shouldn't create any issues in any of the other tasks that we do, even in the remote query facilities. Of course, we need to, for it to be consistent, like Mariam said, when we recreate them, we need to recreate them in such a way that they confirm with the vocabularies that we are using. So when we create them, even in the offline version, we try to be consistent in the vocabularies that we use, so that we maintain the interoperability. Otherwise, I believe these issues are urgent and they need a good attention, and we have been working on them as well with Gateway here in an effort to deploy in either. So we'll report back next week.
Excellent, perfect,
Okay.
good. Very good. Then those were all my questions. Thank you very much, Abdullahi. And back to you, Mariam. Thanks a lot for the clarifications. Really appreciate it.
No problem. Maybe since Samson and Getu have already kind of given an update, I don't know if there's any new updates beside the ones given yesterday. Samson, do you have any new updates? Or maybe you could give a recap from yesterday, or Getu?
Yes, Mariam. We are working in a client server architecture format in IDER, and so far the progress has been very good. And one interesting case that we found out when we went to the facilities is that because of the current situation in Tigray, getting the hard copy registers have started becoming very hard, because they couldn't get the registers used to be printed at the national level and distributed to the health facilities. And due to the blockage, they aren't coming anymore, and there is shortage of paper. And they found the VODAN solution to be a good replacement. And the challenge that we were having on the relevance of what we are doing used to be challenged. I mean, we had systems in place, and there was resistance before the current situation. And the current situation, in fact, has resulted in a shortage of reports and shortage of analytics, because some of the services were also nationalized, and again, because of the blockage, the national DHIS system is also endangered. So there is a gap that we can chip in, and the management and everybody is very supportive now. And we are really hopeful that what we are trying to achieve here would be meaningful and worthwhile to the management. We're planning to have this week or early next week a launching session so that the staff that would be working on in entering data, they would be instructed to strictly use these electronic versions starting from now on. So that is a good positioning, and we are planning to invite everyone here to attend the session. Last week, G2 has been closely working with the data clerks who will be actually entering data, and there was some practice that was done along with G2. Yeah, I think overall we're progressing in a good pace, I would say. Thank you. Over.
Oh, you're muted, Mariam.
Thank you, Mariam. Thanks for that report, Samson. I think that on the session about the hospitals under blockage at the EDDs, this would be a very good report to make there where Dr. Manuel will speak. So we'll discuss that offline, but I would recommend that everybody registers for the EDD sessions. And perhaps, Clara, you can put the registration requirements in the app. But these are important, very relevant points to make on the use of the system, especially when the facilities are under the pressure as they are. So thanks for that very useful report, Samson and G2. Back over to you, Mariam.
Professor, I think there was also a small detail that came from Michele that was very important. They have been having power failure, but then they try to use solar system to operate. I don't know, Samson, you wanted to say something on that? I found it very, very important.
Yeah. Sorry, can you hear me now? Yeah. So unfortunately, there has been an electricity cut down as well the past 10 days. 10 days now, and one of the challenges that we're facing here is that problem. And the building that we work here has a solar inbuilt solar electricity. That's why we are able to connect. Otherwise, the whole Tigray is in complete darkness now. I think that was one of the reasons, the issues that was raised yesterday. Thank you for reminding me, Dr. Janan.
Thank you, Reginald. And maybe the other teams can also look at that possibility in addition to the UPS for solution of power. That would be very excellent. Thanks, Mariam. Thanks, Samson G2.
So maybe now we could have an update from Kenya.
Yeah, thank you, Mariam. So KEMRI, Kenya Medical Research Institute, Seth was able to set up, deploy, and then be able to test, and then be able to at least do some exercises on the system. It seems to be working very well. About the backup, they're also working on the backup to make sure that the UPS is well powered and that they don't have any problems with the power failure. Beacon of Hope, William and Jacinta have done very well. And even I got acknowledgement from the director, Dr. Jane Wathome, feeling very happy about the installation, the testing, and then also the agreement. So I'm just waiting for her to send me the agreement, but she's very excited, and she's the one who has been talking about creating an exchange program across this great family of researchers. That researchers, students can come from Mekelle or from Nigeria or Kampala to work in her institution and conduct some of this research. So that's where we are. Thank you very much. And I think Seth had some report on I think he was asked to go to Tanzania and support Dr. Jeremiah. So perhaps at this juncture, you could also just give an update. Seth.
Yes, good afternoon, Doc, and thank you for this. I was requested to help Tanzania through Dr. Jeremiah to set up the system. We managed to set up the system on the computer. They had I think a Dell computer, which gave us some challenges when we were setting up, installing the virtual machine. But finally we did it and completed. And also we managed to set up the SIDA system on it. We did the tests with we were working with Salum Kalongi. So we managed to set up, and he tested with he had some dummy data which he tried entering, and it was working well. I also helped him setting up the dashboard, which also was successful. So far, they only have to continue testing the system, but from the technical part of it, it's running well, and they're able to use it. Thank you.
Thank you for the update. Maybe we can get an update from, well, I think now the only country left is Uganda. So I'll give the updates. So with the Ugandan team, the system has been successfully deployed at Case Clinic and Lira Referral Hospital. This was done with the assistance of one of our data stewards, Nabombi, who is actually on the call. And also it was successfully set up the KU Teaching Hospital by Ernest. And now we're also getting to transporting the computers to Hoima. Hoima actually just shared the signed agreements, the copy, and now the next is to transport the computer to Hoima. And with the data production, they've already started testing with mock data. Maybe also we could get something from a small review of how it went from Nabombi. I can see he's on the call. Nabombi, you can unmute your mic. Okay, well, but according to how it went and the videos that were shared and also the communication from the directors, everything went well, and they're now still learning how everything works and still sending questions here and there. And tomorrow, Ezra will actually be going to Case Clinic to show a bit more on how to enter the data using the CIDAR system, because apparently they got new personnel. But yeah, everything works perfectly. So I don't know if we have any other business on the agenda.
Is everybody uploading the videos on that system of Putu on the drive? No? Hello?
Hello? Yeah.
Yeah, for Nigeria, I think we've had quite a number.
Okay.
And then we had,
You're frozen? Oh, sorry.
yeah, you can go ahead.
Everything frozen
just saying,
on my side. You can go ahead, no worries.
just saying the Nigerian, almost every facility in Nigeria made attempts. Some came with some poor quality, so we're asking them to do the video again, and even sending down our data stewards to support them in shooting those videos. So before the week runs out, I think almost every facility should have a video of them, using the system, introducing themselves, and more importantly, seeing the system in action right in the facility. Thank you.
That is excellent. Should we send the drive again of Putu for everybody, or Reginald, is it clear?
Yeah, it's very clear. It's always good to resend. Sometimes we may lose it, but there's been a lot of work done behind the scenes. I think it'd be nice to repeat it again.
Yeah. Does anybody have the link of that drive?
I think we do. We could share in the group.
Yeah, I'll get it. Yeah, I have it somewhere.
Okay, good. Then, yeah, it's good, I think, to reshare. Perfect. The Michele team has its hand up.
Okay.
Yeah. Hello, Miriam, and good afternoon all. This is Araya. So I just want to mention one issue and bring into the attention of you, Miriam, Reginald, and Francisca. As we move to the deployment phase, I think we need also to have a good documentation so far. And in the previous weeks, from the deployment, especially from the Nigerian team, we have heard the technical challenge, like the electricity and the internet issue. That is really good. But what I want to bring into the attention of all of us is, as you remember all, in the contract agreement, partnership agreement, there are roles distributed among members, like the privacy, capacity building, data access, data stewardship competency, security issues, and data quality monitoring. So these are related also with the deployment issue. So as we hear every week with the progress update and with the learnings, it could be very useful. What are the issues being raised from the stakeholders or from the deployment in relation to privacy, in relation to issues of security, issues of access, issue of data qualities. And just parallelly, we have to hear any concerns or issues in this regard. In the contract agreement, they are well described, listed, and the responsible persons are indicated. I know Dr. Sakinat, for instance, she is working on the competency requirement for data stewardship. And we are talking as well about the data, the capacity of the people we are involving. So what are the learning in these aspects could be useful. So I want to say that in our weekly updates, it's good to hear about these issues. Thank you.
I can, if you allow me to share, Mariam, we can put those roles on the screen. I think is a really excellent point that Dr. Raya makes. So here we have, well, Dr. Reginald, he's always reporting back as the country coordinator. Putu has been taking courses and also has identified very specific points that need to be addressed from the perspective of the protection of privacy. So Putu is very much on speed. As soon as he will be back from holidays, I think he'll be chasing all of us on this. Dr. Ibrahim and the security side, I think it will be good if we start reporting here in the weekly meetings on what security issues we are finding. Today we have heard of the loss of data, and Rudwan has said correctly in the WhatsApp that here the problem of the loss of data is a very expensive issue. So the UPS, that this needs to be deployed and that in places where there is not a secure power, there needs to be an alternative provision to prevent data loss and computer loss. That is something that I think Dr. Ibrahim will be picking up. Then the issue of the IT architecture and documentation with Alia. Alia is also on holiday, but that will need to come back. Mariam, you have talked today on the data interoperability and the queries, and if we use the templates as suggested without onto-portal dependency, how would that work? That has been touched upon. Then Araya, you have talked about the documentation of the preparation and the coordination. And I have missed a few meetings, so maybe I'm behind. But I don't know whether in the meantime, there is already a strategy of how we do this in these. We could kind of see a matrix around all of these issues and the deployment in each place. Then Rudwan is, in fact, this is wrong. It's not machine learning engineer, but is the data scientist, data analytics part. And that will come in as we are starting to look at the quality control of the data, which is with Kawu. Then the quality control and system integration is with Samson. He has made the suggestions today. The dashboard with Ezra. And then here Jamal, which will be forthcoming, the data stewardship competence and the capacity building. These we have maybe not touched upon on this meeting. So the suggestion of Araya is a good one. And maybe, Araya, we could have a spreadsheet or somewhere where we document this facility by facility in groups of countries, and in which each of those responsible then have received the documentation of those that are in charge of deploying and make the analysis and make the suggestions, and that we also document the suggestions, because I've been taking notes here, but that is not a structured documentation across the network. Araya, is it right that you would make a proposal for that?
Yes, I can make for our next meeting, and if you have time, we can also discuss as well.
Yeah, I like it. It's good. So back to you, Mariam.
All right. I think we've also covered any other business. I don't know if we have anything else, or anyone else has something or a point to raise at this point.
Well, just wanting to say thank you to everybody for where we are and where we stand. There's a really, really good progress, and a lot of hard work, I realize, has gone into. It's easy to discuss in 1 hour meeting, but a lot of work that preceded all of that. So big appreciation for everyone and for the thoroughness in which it is discussed and evaluated and investigated for further improvements. This is really very, very good. I'm so happy and so proud. Thank you very, very much, Mariam and everybody.
Thank you, Miriam. So I guess with that said, have a good evening, everyone. Bert, do you have any closing remarks as well?
Well, not really any closing remarks. I think everybody knows that I'm always very, let's say, positive and enthusiastic to be on this call. And I'm so happy to see that after the positive remarks at the symposium, that energy is still there. So this is good. Makes me very happy to actually see that after the achievement, we are still moving on. Excellent job by everybody.
Thank you, Bert. All right, that's it. Bye, everyone. Have a good evening.
Bye-bye.
Bye.
Have a good evening.
Bye.
Bye.
Hi.